my name's Tiffany. I'm doing the SAFMEDS standard celebration video, checkpoint 2. First, my instructor is Dr. Amy Blake. The course is SPCE 682, and the date is 10/06/2024, October 6, 2024. I'm going to start by shuffling my cards. Cut them in half and shuffle my cards. I'm not great at. And then I'm going to put on my 1-minute timer and go ahead and start. Okay, so the first one is cultural match, which is meaning if you are respecting the client's family and their traditions and their culture and their religion that they might have, and just ultimately just having respect for the family, which I think everybody should have. The next one is cultural humility. That is having respect, having a sense, honoring them, honoring their beliefs, not, trying to force things that you believe in or, onto the family just because they have specific rules and guidelines that they're abiding by. And so you need to be respectful of that. No matter what you think, you can just give them, hey, this is like what I'm doing, and this is how we, protocols that we do go by with ABA. And if that works for the family, then that's great. And that was it. And if they're not okay with it, then, maybe refer them to something that is more in line with what they want to do. Discrete trial training is when you're with the client and you kind of take them over to the side to do skills. They have been recording the antecedents and the behavior and the consequence. It's like taking materials over to the side. Some things could be like the client matching. Some things could be the client, it could be matching. It could be like differentiating between colors or shapes. I don't know why my mind just went blank just then, but it could be things like that, and just taking them over the side. Errorless learning is teaching strategy, and it minimizes the recording of incorrect choices. Joint attention is, I'm going to pass on this one. It's not great. Least to most prompting. So you're going to, the most, you can go from like independent or, first we do independent to just see how the client, what they can do, but then you can move on to partial prompting. You can go on to full physical if the client has seen it and if they're okay with it. Mastery of the criteria means that the individual has learned the specific behaviors. The treatment goal, like what is I shouldn't say the goal, but what is, have they reached that point of getting to where they needed to be for a specific task or a specific thing that we have for the client to do. Modeling is like if I'm with the client and, I'm showing them how to wash their hands. Sometimes it does help when you're washing your hands alongside them because you're modeling correct hand washing. Most least prompting, I feel like we've gone through that. You could do full physical prompting, which is the most prompting, and then partial prompting, or full prompting could be like, oh, okay, you want that one, and you kind of take their hand and do a hand over hand. But partial could be like you're more leaning them to the answer, and independent, they're doing it by themselves. Performance deficit, I'm gonna pass. Time out when they have a moment where the access to reinforcement is completely removed. Treatment accessibility. I'm going to pass that one. Peer-mediated interventions. I would say that would more be like reciprocal play. That could be an example of peer-mediated intervention, something that is trained or supervised and monitored. Pivotal behavior, I'm going to pass. Feasible, meaning that is it something that the client could do? Is it something that like a benchmark that is not too high for the client? Like, for example, I have a client, he's 10 years old, he's been in ABA for 3 years, and he hasn't been able to write his name. I think that it becomes aversive for, you know, anybody who comes in to be like, you're going to watch, you need to go ahead, write your name, do it now. And that's not something that he's ever been able to do before. So I think, of course, like you could still come in and do that with the client. But that wouldn't be like necessarily like a focal point that we'll be working on with him with handwriting. Positive behavior support. So I work for PBS, so I'm very familiar with that. It's evidence-based strategies used to increase the quality of life of a client with challenging behavior by teaching them skills in a person's environment. Precision teaching and individualized strategy that could be building, like self-building for the client, which is like fluency and reinforcement could be an example of that. Prompt. You have prompting is like, I think it's just assisting the client. Sometimes they do need a prompt. Do you need to go use the bathroom? Oh, you do? Oh, fine. Let's go to the bathroom. You know, prompts like that. That would be an example. Maintenance is, you know, if a client has already learned a behavior, we're just keeping it up, maintaining that behavior, making sure that they're still doing what we've taught them or behavior that they have learned that is really good. We want to help to maintain that behavior. PLA checklist, I'm going to pass on that. Self-determination is a person that takes control over their own life. Stimulus discrimination, whether you could tell the difference and discriminate the difference between a stimulus. Stimulus generalization happens when it's like a new stimuli or like new setting. I'm gonna put that to the side. Structured play groups of having like small group activities where we're having play. ABA is play, but with other peers where they could learn new skills and new strategies. Symbolic play, children are able to use objects to represent things or adults. Prerequisite skill is like what we have seen before prior to teaching skills. Video modeling is a procedure that is used when, you know, you could go ahead and pull out a video of something that they could see. Like I said, a video of somebody washing their hands. Visual support, if you have, for example, of someone who's like sitting down, something that a client can look at and be like, oh, this person's sitting down during instructional time. I need to sit down during instructional time. Preference assessment to see what the client wants, what it could work as a reinforcer. FCT, I'm going to go ahead and pass. Planned ignoring, if let's say a client is like really, the function of the behavior is attention. Yeah, and it's time to go ahead and do work and it's a test and you're making noise and your whole purpose is to go ahead and get attention, you're going to want to plan ignore that client because then it loses its weight, it loses its power. Generalization, learning to respond to a stimuli, similar to one another. Parallel play is when someone's playing next to your client, and he's okay with it, like they're playing next to another child or next to another adult if you have an adult client. Methodological, I'm going to pass that. Systemic review, I'm going to pass that. Practice your guidelines. We should always practice skills. ABA is always constantly changing and new things could be put into place, so we always need to practice our guidelines. Mass trials, I'm going to pass. Listener responding, it's a verbal SC, which is followed by a nonverbal response. Man training is when a client wants something. So when a client is saying like, oh, I want candy. I'll be like, oh, you want candy? Oh, let's go ahead and here, I may give them a candy, or may I be like, oh, maybe we should eat like a carrot, bite of our carrot first, and then we can have candy. Introverbal training is just being able to have a conversation back and forth, where it's just like, hi, Jordan, how are you? And it was like, good, I'm having a great morning. That would be an example of having an introverbal conversation. Service agreement, I'm gonna go ahead and pass. Communicating about services, that's very important. Like what things you would like to change if you like how services are going, whether that's the parent or the teachers or anything involved about the behavior, because communication is a big thing. Fading is when we're going to pull away from the client, like we're going to start fading the RBT out because we think like that they could be more by themselves, that they're more independent. So we're going to start that fading process where some things don't need us in, some things we don't, because we want them to be more independent. But yeah, that will conclude my video. Bye. Have a great day. Bye.